I'm sure everyone here knows by now that our fourth annual health symposium is underway. I can't believe we're already halfway through October and we've already made it to session 3 of our month-long symposium. Um, like I've said for the past few weeks, this is truly one of the highlights of the year for all of us at Good Dog because it's a really great way for us to give back to our breeder community and help bring these amazing educational opportunities right to your laptops. If you're Danny, you're sitting outside in the sun enjoying the presentation, so that you can have the best access to education without having to leave your homes and have it really be something convenient for you to hopefully implement into your program. So that's what this symposium is all about. And it's been amazing to see how our community has gotten together to learn so far, but we have a lot more learning left to do. So to continue our month-long event, we have Dr. Fran Smith back with us again for part 2 of her presentation, Pediatric Puppy Health, 6 to 12 weeks. So in case you missed part 1, which was neonatal and infant health, birth to 6 weeks, we're going to drop a link in the chat to that recording so you can watch that after this, so you can bring both of these presentations together in your minds. And then if you missed session 1, which was at the beginning of this month, which was with Dr. Barstow on breeding healthy dogs part 1, we'll also link to that as well so that everyone can see all of the past sessions we've done so far and catch up. And in part 2 of today's discussion, Dr. Smith is going to be walking us through a surefire weaning strategy, which I imagine is going to be very helpful for many people here, the best foods for a puppy, and what's recommended in parasite control, vaccinations, and socialization. So lots of exciting stuff for us to get to today. Before we do any of that, I just want to again thank all of our friends at Purina Pro Plan for sponsoring this event and helping to bring it to life. We are so grateful for our continued work with them and that they help bring events like this to our community. As always, we have Q&As at the end of this presentation. We're going to prioritize some of the previously submitted ones first, but we will also do our best to get to the ones that you ask live in the chat as well. So please feel free to use the chat at any time to ask any questions, and we'll try to get to those at the end. And as a reminder to everyone, we're doing things a little bit differently for this year's symposium, meaning we want to reward you for all of the new knowledge that you're gaining. So after each session, we're going to be posting quizzes in our private Facebook group and in our Friday newsletter. Just a few questions about that week's session, the things that you learned. And if you complete all 4 quizzes that we're going to have shared by the end of the month, you're automatically eligible to win really exciting prizes from our partners like Purina and Snuggle Puppy and Revival. So really cool opportunity to put your knowledge to the test and get rewarded for it. So we have quiz 1 and 2 already up in our private Facebook group. If you missed those links for whatever reason, we can both drop them in the chat here, or you can just email us at breederteam@gooddog.com and we'll get those over to you. And then session 3's quiz will be posted a little bit later after this, so you can take that. And then next week will be our last quiz, and we'll announce our winners for our prizes at the end of the month. So just wanted to remind everyone that that is still going on. So please take advantage of that if you haven't already. And I want to quickly share a little bit about Good Dog for anyone who is just tuning into our symposium and has no idea who we are, why we put this event together. Good Dog is on a mission to build a better world for our dogs and the people who love them by advocating for dog breeders like yourselves, educating the public, and promoting canine health and responsible dog ownership through events just like this. We're a secure online community that is created just for responsible dog breeders to connect with serious, quality Good Dog applicants to find forever homes for your puppies. And based on the chat, there are lots and lots of puppies on the ground right now, which is exciting. We use the power of technology to help our breeders level up their programs by giving them tools like our secure payment system to protect them from scams, and our software to post your available litters and start connecting with Good Dog applicants, as well as a number of free educational resources like this, health-related discounts, and more, just all designed to really help your breeding programs thrive and give you much needed time back to be with your dogs and worry less about running your programs. So if you are not yet a member of our community and any of that sounds exciting to you, which hopefully it does, you can learn more about our mission and apply to join at gooddog.com/join. And then with all of that out of the way, I just want to reintroduce Dr. Smith. Even though we had her last week, I want to share a little bit about her background in canine health and then pass things over to her. Dr. Smith became a diplomat of the College of Theriogenology in 1986. Since that time, she's been in private practice as a small animal practitioner, specializing in canine reproduction. So, no one better here to have this talk than her. Dr. Smith is one of very few board certified theriogenologists in private practice. Her expertise in genetic counseling, chilled and frozen semen, and reproductive infertility of male and female canines is known throughout the United States. Dr. Smith frequently speaks to breed groups, veterinary associations, and students, and the general public. She retired from full time practice in March of 2023, but maintains licenses in Minnesota, Mississippi, and Colorado. Dr. Smith grew up in a military family that bred German Shepherd dogs. I think we have some here. Her commitment to veterinary medicine began at 7 years of age and was confirmed in her high school yearbook, which stated her goal was the patter of 40 little feet, not human. That is my favorite fact about you, Dr. Smith. So with that, I will pass things over to you for part 2 of this presentation.
Good afternoon and welcome to all of you. So today we're going to follow up with the next section after I talk to you about the brand new newborn, and that is the puppy 6 to 12 weeks. I realize for many of you, you will place your puppies at 8 weeks, but you can use the information in this talk to help your puppy buyers and your new puppy homes know what they should be doing with their puppy. So this talk is going to center on immunology and vaccinology, which are important issues for all of us who breed dogs to understand in our breeding program. So as Nicole said, my name is Fran Smith. I'm a veterinarian with a PhD, and I'm a diplomate of the American College of Theriogenology. That specialty has under 350 specialists nation and worldwide, and is comparative, meaning people trained in that are trained in all species of animals, not dogs or just cows, etc. So I'm a specialist in theriogenology. I'm the president of the OFA. In fact, tomorrow I am leaving for our OFA board meeting, where we will have a lot of exciting things to discuss, including deciding where we will spend our research dollars this year, and also discussing what issues are important today in canine health. I'm the president of the Labrador Retriever Labrador Retriever Club and the healthcare person, and I'm a dog breeder of Labrador Retrievers under the registered name Danik. So an important thing for you to know is that during pregnancy and for 4 weeks after pregnancy, the dam is immunodeficient. For all the years that I've practiced as a veterinarian, one of the things I always ask every client who was considering breeding their dog is why? And then I point out to them if they have a good reason, and there's many valid reasons to do it. The last question I always ask them is, because many of the clients would say, I love this female more than any dog I've ever had, and I'd like to have one just like her. I say, to do that, are you willing to risk her life? And I say that because pregnancy in any animal affects multiple systems, including the immune system, which has to back off a bit during pregnancy in order for the female to maintain the pregnancy itself. It affects her cardiovascular disease, her respiratory tract, and her hemolymphatic system. This change is necessary in order to maintain the pregnancy and is normal, but that has implications for you and for the mama dog. Why does this happen? It happens so that the mother can stay pregnant. If her immune system did not back off because of the type of placentation we had, the immune system could in fact impact the neonate, the puppies. So puppies are born immunocompetent, which means they have an immune system that functions, but hasn't started to function fully. So the complex maturation of the immune system of the newborn puppy does take time. Factors in puppy survival are what I would call innate immunity and innate survivability. We've all seen litters where all the puppies come out kicking and screaming, immediately head toward a mammary gland, want a nurse, and other litters that are born apparently in a normal fashion where the puppies are kind of limp and uninterested in life. So that's an innate desire to live. Also, puppies' survival is influenced by acquired immunity, which can be due to recovery from disease or vaccination. And we're going to talk a lot about that. And last time we did talk about passive transfer of maternal antibodies, and we're going to talk about more of that today because it influences how we vaccinate. So the immunodeficiency in the mom allows the fetus to survive, but that immunodeficiency in the mother dog makes her susceptible to environmental issues such as bacteria, virus, toxins, heat, cold, any kind of stress. Due to that immunodeficiency, the female has increased shedding of infectious microorganisms. So one of the things that I want to share with you that she's likely to share, and we're going to talk about it later on under parasite control, nearly all dogs harbor coccidia in their GI tract. And when there is stress, and certainly pregnancy is a stress, and when their immune system is decreased, which it is during pregnancy, a mother dog is very likely to shed coccidia, which can contaminate both the environment and her offspring. Additionally, the dam sheds GI viruses such as corona, rotavirus, and E. coli. Just so you're all aware, rotaviruses do cause canine diarrheas. There is no vaccine for them, and typically they are quite mild. E. coli is a bacterial organism that can affect many systems, and it is ubiquitous, meaning pretty much everywhere. So again, a pregnant female is a source of E. coli to other organisms. So how do these puppies get infected? A dam can infect her puppies at birth or around the time of birth. And an important viral disease that we're going to talk a little bit about is canine herpes virus. Canine herpes virus infects the puppies typically during travel through the birth canal. And again, many females are exposed to herpes virus and they develop antibodies on their own. In adult dogs, herpes virus is pretty inapparent. You might have a few small vaginal blisters, something like that, maybe a little sneezing, but they don't get sick. On the other hand, puppies that get infected with herpes virus from their mothers, and the infection occurs prior to 10 days, it is a highly fatal disease. So if she's already been infected, typically, and particularly if she's infected in the last trimester, then she is likely to infect her puppies at birth. We'll talk about how to keep the puppies from getting sick with herpes virus, and that involves heat sources. The puppies can get infected from an external source, other dogs, and fecal contamination. I strongly recommend that any pregnant female be absolutely in a cocoon for 6 weeks, 3 weeks before she whelps and 3 weeks after, to prevent her sharing new organisms with her babies. That means, and by that I mean strict isolation. Many people will tell me in an exam room, well, I don't let her play with other dogs, but they take their other dogs to training class or to a dog show or to a friend's house, then let the dog that traveled to this event out in the yard, and then let the mother dog out there after the dog that traveled has been in. That is not isolation. So remember, we talked about the placenta last time and how it is a band that surrounds the fetus in the sac and attaches around inside the uterus. That placenta is involved in transfer of antibodies and the protection that the puppies get. So again, the canine has an endothelial chorial placenta, and the puppy gets only about 5% of its maternal antibodies through the placenta during development. 95% of the maternal antibodies come through consuming colostrum. So when puppies get colostrum, the immunoglobulins in puppies that get colostrum, that's 12 to 24 hours after birth, and it starts to decrease at that time. So there are three major classes of antibodies: IgG, IgA, and IgM. Colostrum is predominantly IgG and is quickly absorbed. Milk is predominantly IgA, so it's a surface antibody. It works like on the top of the gut, or in the case of some vaccines, it works in the respiratory tract, right on the surface of the respiratory tract. So remember again, milk is predominantly IgA with low levels of IgM and IgG. Again, I'm not trying to turn you into immunologists, but IgG is what is really needed to protect animals against most infectious diseases. Immune response of puppies varies. It's going to vary with that puppy's innate immune system. It's also going to vary with how much maternal antibody they get. There are individual differences in immune development. Every puppy in the litter does not have the exact straight line development of its immune system, nor does each puppy get the same amount of maternal antibodies. A puppy that nurses colostrum from one of those big rear end mammary glands is probably going to get a little more antibody than a puppy that's nursing way up by the front leg. And also the route in which the antibodies are delivered. And the route that antibodies can be delivered is oral, intranasal, or intramuscular or subcutaneously. So the duration of immunity that puppy gets from colostral antibodies is varied. That's important because some puppies have lost all their maternal antibodies by 5 weeks, and in some cases, it's as late as 20 weeks. This is why puppies need a series of vaccinations. What that means for you as a breeder is, unfortunately, for many puppies, their maternal antibodies will have declined to the extent that they're not protected from distemper, parvo, or any other disease right around the time that they can go home. But as I'll show you in the next few slides, they're also not able to respond to the vaccination that you're giving them. This is why puppies need a series of vaccinations. Vaccines given prior to 6 weeks of age rarely are of any benefit. So I see protocols that come from different breeder sources and different breeders where people start vaccinating puppies at 4 weeks. That really makes no sense unless you know that those puppies got no colostrum for 2 reasons. Number one, if they have maternal antibodies, the vaccine won't work. And again, their immune system is so immature that even if they respond, it's going to do poorly. Another thing that I see as a vaccination mistake is vaccinating too frequently. When a vaccine is given, it triggers the immune system and the puppy has an immune response. That immune response reaches its peak at about day 7 to 9 and then continues to rise. But if you vaccinate on a weekly basis, you both decrease the effect of the vaccine given first and prevent the second vaccine from really doing much to booster it. So you are being counterproductive with weekly vaccination. So never more often than every 2 weeks. or you may end up with effectively having no vaccine effect at all. A puppy after its initial series should have booster vaccines again administered at 1 year of age. And we're going to talk about the series of vaccines. Let's talk about rabies. Rabies is the single vaccine that is required by law in most states, federal, and in most locales. I get the question all the time, is it safe? It has been tested, safe, and effective in puppies as young as 12 weeks of age. And again, by law, and this is federally accepted, a rabies vaccine is only considered valid for 1 year when it is the initial vaccination. So let me use an example. You're not a dog breeder today, but you have rescued a dog and you find it on the street and you estimate it to be an adult. It doesn't matter whether it's 8 weeks old or 3 years old. If there is no proof of age of the dog, and always the initial dose is only good for 1 year. Reasons to vaccinate. You try to protect an individual animal. That's very important. You want to protect your kennel population, a term called herd immunity. The same thing happens in humans. The reason polio vaccine worked is after you get a certain percentage of the population protected, there's not much of a source of virus to the unprotected. Same thing happens with parvo and distemper in kennels, et cetera, et cetera. So, and we're going to talk again about non-clinical carriers of infectious disease. It also serves as an immune barrier for zoonotic and emerging disease. And it also, the vaccine can protect the fetus from infection. You can also have in your kennel situation decreased shedding of infectious agents from the subclinical carriers to susceptible individuals. So I want to talk to you about a complicated issue that happens with vaccines. And then I have slides later to help amplify this. As an example, if you are using a good quality vaccine and it is given to a female and she gets a good vaccine titer is considered a hemagglutination inhibition titer of about 512. Over time, that titer will decline, and it will decline in an adult at a relatively predictable rate. And over time, the titer will approach a hemagglutination inhibition titer of 80. If at that point, that female in your kennel encounters a source, and we're going to use parvovirus as an example, parvovirus particle, it's taken to a park and it steps in feces where there's parvovirus particles, you bring it home on your shoes, etc. That female will then respond to that insult and will mount an antibody response. So at 80, she will become infected with parvo. She won't become sick, but as her titer goes up, she will shed those parvo and shed the virus to other dogs, allowing them to become ill. So again, we vaccinate these puppies to protect them from disease by giving them colostral immunity and the little bit of immunity that they get in milk, which is called lactogenic immunity. When and with what should you vaccinate? Vaccines should always be tailored to your individual situation. And I will also tell you, vaccines should never be split. I have people ask me, I have a toy dog, should I only give him a half a distemper or a half a parvo? No, the viral load in that vaccine is documented to be what is necessary to trigger the immune response of any breed of dog. So in some areas of the country, though, you're going to give vaccines that you might not give anywhere else. I'll give you an example. In the Southwest and in California, it's very common for dogs to be given rattlesnake vaccine. You're not going to need to give rattlesnake vaccine in an area where there's not rattlesnakes. So again, individual situation is important in the decision. So in most of the country, though, you will probably only give core vaccines, and these vaccines are designed to protect against infectious disease that is what we call ubiquitous, present lots of places. Some injections given to protect against disease contain modifications of virus, and examples of those are parvo vaccine, distemper vaccines, etc., even rabies vaccine. Rabies vaccine, the virus is killed. The others in distemper and parvo, they're modified differently. Other injections given to protect against disease are actually bacterins, which are made by modifying a bacteria, such as leptospires, which cause leptospirosis. One thing you should know about bacterins, because of the way they are made and because of the behavior of bacteria, you do not get immunity that lasts as long from a bacterin as you can from some viral vaccine. So core vaccines, these are the ones that are considered necessary in all areas and in all dogs. They include canine distemper, canine adenovirus, and canine parvovirus. The non-core are given to specific populations and sometimes specific areas of the country. They include canine parainfluenza, canine corona, bordetella, borreliosis, which is Lyme, the flu vaccine, and the kennel cough complex vaccine. And I'll give you examples of that. For the many years I lived in Minnesota, my dogs always got Lyme vaccine because we had a huge number of Lyme cases there due to the Ixodes tick. Here in Mississippi, we don't really have much Lyme disease at all. So while I still give it, it's safe, it's not absolutely necessary. Canine coronavirus is a viral disease of dogs that's been around for a very, very long period of time. And as you probably all know, humans get coronaviruses as well. With canine corona disease, it is the disease that in its natural state, meaning the best immunity that you can ever get from any disease is recovering from the disease. So if it doesn't kill you, you're likely to have great protection, okay? With canine coronavirus, if a dog gets corona today, within 3 months, it can get corona again. And I will tell you that just for information's sake, COVID is a coronavirus, which is why we have all this shift and you need to continue to do different things. In general, I do not recommend giving canine coronavirus, not that it's not safe, because it is absolutely safe, but because it gives very limited protection. It comes out in many combination vaccines, because if you are unfortunate enough to have a kennel that has both parvovirus and coronavirus in the kennel, the dogs get much more ill than they would if they were infected with canine parvovirus only. So this is an example of the Borrelia burgdorferi bacterin. As I told you, this is for leptospirosis. I'm sorry, this is for Lyme disease. And it's a bacterin built on part of the Lyme tick itself. I will tell you that I am not brand loyal with the vaccines that I use, and you'll see this. I buy based on availability primarily at the time. The Lyme vaccine there's several different types. This one works well and it's safe. The initial vaccine typically requires a dose of 2 doses, and then after that, annual vaccine, and this vaccine is approved for a 1-year interval. This is the flu vaccine, canine influenza vaccine, H3N2 and H3N8. This virus started out in Florida, probably in greyhound kennels, and it causes a lot of upper respiratory disease in dogs. And it can be given safely after 8 weeks of age and is very effective. Again, it is a killed virus vaccine, and it should be given annually if you have your dogs who are out and about and are interacting. Where it's really a problem, the flu itself, not the vaccine, is a problem if you have a pet dog that seldom goes anywhere, and then it must go to a kennel and it contacts dog flu. That dog is going to be much sicker than a dog who has had vaccine in the past and has been active in other activities, going to boarding, going to training, et cetera, et cetera. The dog flu itself is typically not very dangerous, but a dog who gets dog flu who remains ill for several weeks of time is very likely to get pneumonia and potentially a fatal pneumonia. This is a combination vaccine. This happens to be the vaccine I most recently have used on my own puppies. And this is this is the kennel cough complex vaccine. This particular vaccine is given intranasally. And as you can see, it's canine adenovirus 2, which also protects against an old disease that we call canine hepatitis, parainfluenza, and Bordetella bronchoseptica. It is given intranasally, and it is safe in puppies as young as 3 weeks. The advantage of using an intranasal, and according to package directions, the intraoral, it does stimulate the immunoglobulin we talked about, which is IgA. So you get very rapid production of antibodies, and it can be done very early and very safely. So this stimulates IgA. This is the vaccine that I use for my own dogs, not necessarily always this Zoetis brand. I give distemper adenovirus, parainfluenza parvo, and L4. That stands for Leptospira 4. There are hundreds of different varieties of leptospirosis, and they occur in many, many other animals. So if you're going to do lepto vaccine, you want to use the vaccine that has L4 rather than L2. So timetable to vaccine. When should you start? We already talked about you don't want to vaccinate 4-week-old puppies. At 6 to 7 weeks old, you want to give a core vaccine plus the kennel cough complex. So that would be canine distemper, adenovirus, parainfluenza, and parvo with the kennel cough complex. Again, I recommend intranasal or intraoral. There are injectable kennel cough vaccines, but they require a booster in 2 to 4 weeks, so the first dose does not give the puppy a lot of protection. At 9 to 10 weeks of age, you want to give the core vaccine again, plus Lyme if you were going to give it. And at 14 to 16 weeks of age, core vaccine plus rabies. Now, there would be no reason at all that in this interval between 10 and 14, you certainly could give rabies then. And if you chose to, you could double this dosage and do it every 2 weeks, but that is unnecessary. Vaccination against lepto can begin at about 6 weeks. And you probably all have heard horror stories about lepto causing all kinds of vaccine reactions. There are a couple of breeds of dogs that are somewhat susceptible to a reaction from lepto. and those are miniature dachshunds and Weimaraners primarily. Otherwise, the typical side effect, if any, that you're going to see is it stings. I like to use little tiny needles, but some puppies will really, really squeal when you give them the lepto vaccine. Why is lepto important? And remember, we talked about the fact that it is a non-core vaccine. The leptospires are little organisms that are in water, puddles, lakes, streams, etc., any puddle at the park. And they are spread primarily by rodents, deer, and cattle who shed them continually in their urine. I will also tell you leptospirosis can infect humans. And a very good friend of mine got leptospirosis in Washington, D.C., in a park where he took his dogs to swim, where he got splashed with water, and the water in that park is heavily contaminated, unbeknownst to him, with rodent urine. And he nearly died of this infection because it can cause massive organ failure. In dogs, it's the most common cause across the entire United States of acute kidney failure. So yes, it stings a little bit, and yes, it's not perfect protection, but anything I can do to keep one of my dogs from going into kidney failure, I'm going to do. So let's talk a little bit more about kennel cough. The syndrome is associated with viral and bacterial agents, and it's primarily Bordetella, canine parainfluenza 2, adenovirus 2, and mycoplasma. All of those organisms together can give a puppy a whopping case of respiratory disease. And I see I spelled Bordetella here. It's not Bordetella, it's Bordetella. It's capable of causing the disease all by itself. Some of the kennel cough vaccines are Bordetella only. I do recommend using one of the combinations because it's not just one organism involved. Bordetella is spread by aerosol or fomites, so coughing, sneezing, etc., etc. Fomites, if a dog sneezes or coughs into its water bowl and another dog interacts with that water bowl, it certainly can get kennel cough that way. The other thing you need to know is the immunization doesn't totally prevent disease. It decreases how severely ill your puppy gets or your dog does, and shedding of the organism. The incubation of kennel cough complex is 3 to 10 days. And you should know, of all of the organisms in that list, Bordetella is stable in the environment for days to weeks. So you have a dog in your kennel that is coughing, remove that dog, certainly, and sterilize and clean that kennel. And ideally, you would like to keep animals out of that environment for 7 to 10 days, unless you really, really can do a good job of cleaning up the environment. Combination products to minimize signs occur, and the combination products contain adenovirus 2, parainfluenza, and Bordetella. And we talked about this already. The intranasal and oral products stimulate IgA, which is local antibodies. How do dogs get this disease? They inhale it. So it makes sense that if you protect that airway, you're going to get rapid, fast protection with the disease, against those diseases. And again, the injectable products typically require a booster. Canine parvovirus, every kennel owner's nightmare. It's found everywhere. It is carried by a high percentage of dogs as subclinical infection. These dogs aren't sick, but they shed it. The virus can remain in the environment and on surfaces for up to 12 months. You can use a blowtorch on it. You can freeze it. In Minnesota, the virus will survive in all freezing temperatures. Cleaning up, you can activate the virus with disinfectants, usually quaternary ammonias. They have oxidizing activity, heat, and diluted bleach. I know a lot of you use bleach water in your kennels, and the right recipe is an ounce of bleach to a quart of water. What you probably don't know is once that bleach is diluted, after 4 hours, it has no efficacy. It's not useful for any kind of disinfecting. It might still smell like bleach water, but it doesn't have any disinfecting ability. So remember that 4 hours with your bleach solutions, then discard them and make new solutions. Infection with parvo occurs by the fecal oral route. And again, incubation is 3 to 7 days. It's most serious in young puppies, but may be seen in 12 months of age or older if they're not successfully vaccinated. So the two peaks that veterinarians like I was in practice would see parvo, we would typically see it in a 9 or 10 week old puppy who typically had a vaccine at 6 or 7 weeks. And then the second group that we would see it in were dogs around 8 to 9 months of age who had vaccines that stopped at 12 weeks. Again, we talked about the fact a dog with a marginal titer, if exposed, may seroconvert and shed virus. So some of these dogs that are barely protected when they get exposed are a real source of infection in your kennel. So this chart is very, very interesting. So this is an example of the titer levels. We talked about 512. So the blue bars, just for illustrative effects, all of the numbers are titers. And with parvovirus vaccine, what we know is maternal antibody decline is halved every 9 days. So if you have a female who whelps a litter of puppies and her titer is 512, for easy math, we consider it 100%, but they don't get quite that much. On day 1, the puppy will have a titer of 512. It is very well protected against parvo. At day 9, it'll be 256. At day 128, I'm sorry, at day 18, it will be, this chart is actually wrong. At day 18, it will be 128, and it will continue to decline until, but when the puppy's titer gets below 80, I don't know if I can use an arrow, we're going to try that. Once the puppy's titer declines to here, it is capable of becoming infected with parvo. It may not get sick, but it may seroconvert. However, a titer of 80 or more prevents the puppy from responding to vaccine. And the puppy actually cannot respond to vaccine until its titer is below 8. And so you can see this part of the chart is correct. And the puppy then has to be, 63 days old to reliably be able to respond to vaccine. So this is a better example, I think, Stephen, 128, 512. Looks like I did a better job on this one. This is a female, whoops, I'm sorry, let me go back there. What? Okay. Maternal antibodies, once the puppy is down to here, the puppy at 36 days, this is a, oh, I am so sorry. Once a puppy's, this is a female that actually recovered from canine parvovirus. So we talked about the fact that recovery from disease gives you the best immunity. So you can see that this female's immunity is 4 times the amount of this dog. So this is vaccine titer, which means the maternal antibody is going to fall off much, much later. And the end result is these puppies from this age, from really about day 30, all the way out to day 54, if you vaccinate them, they will not respond to the vaccine. They may or may not get sick. At the very, very end, once it's 8 or below, they are very susceptible to disease, but can respond to vaccination. So for most puppies, you have a week to 5 weeks. Oh, mother. I think I need more coffee. Okay. You have a block of time of 5 to even more weeks when a dog is not safe to be around other dogs and can easily become infected with parvo. That's why we see that trend at around 9 to 10 weeks. And again, for the puppies that didn't get their last vaccine, close to 20 weeks at around 9 months of age. Canine distemper is a multisystemic disease of dogs seen in puppies that are a little older, between 3 and 6 months, and that's because maternal antibody lasts a little longer, and it's easier for a vaccine to overcome the maternal antibody for distemper than it is for parvo. The virus, again, can be carried by adults. It's spread orally, sneezing, coughing, etc., etc. And it's estimated that at least half of the distemper vaccine infections are subclinical. These dogs are just sneezing, and they may shed virus for up to 60 days post-infection. Canine distemper can cause abortion, stillbirth, and birth of weak puppies. If a puppy gets infected with distemper as a very young puppy, it can cause very serious cardiomyopathy and heart failure. The only control is a vaccination, a puppy series, and boosters at about 6 months and again at 1 year. Let's talk about rabies a bit. Rabies is a viral disease caused by a Lissa virus. It can affect many mammalian species, just so you know. Rats, mice, hamsters, guinea pigs, rabbits, and squirrels do not get rabies. In the US, some of the biggest sources of rabies are skunks and raccoons. Today's rabies vaccines do contain killed virus and are safe and can be given to any dog 3 months of age or older. Rabies vaccination is required by local law, and most states have a requirement. In the city in which I practiced in Minnesota, Burnsville, they required rabies vaccine at 3 months. And if you had a dog that was not vaccinated, you could be fined. Many of the other locales required it by 6 months. But any dog that's going to go outdoors can potentially encounter a rabid animal. And you don't want your dog, A, to get rabies, and heaven knows you don't want to get rabies because it is nearly always fatal in humans. Rabies vaccine must be given by a veterinarian or under supervision of a veterinarian to be considered valid, and the initial vaccine must be boosted 1 year after the first. So vaccine for rabies protects 88% of vaccinated dogs from active disease when challenged. So what that means, and I'll give you an example. Again, we're going to talk about how I vaccinate. A rabies vaccine is either labeled for 1 year use or 3 year use. There are certain states which require annual vaccination for rabies. Others do not. I live in Mississippi, which does not require annual vaccination. I give my dogs a vaccine that is approved to protect for 3 years, but I give it every 2 because that's about 1 dog in 10 still and so in order to get a 3-year vaccine, you have to protect 88 to 90% of the dogs when challenged. So I don't want one of my dogs to be in that small percentage not challenged. I live in the country. We have all kinds of wildlife. My dogs don't run loose, but a skunk could certainly get into a kennel run. We certainly have raccoons. So I use 3-year vaccine, and it can be safely given annually. People ask about rabies titers. Some foreign countries will require you have a titer done on your dog prior to entry to their country. Very few places do those titers. Kansas State is almost the only place that does titers. States that require rabies vaccine do not accept titers in place of vaccination. So your dog bites somebody and it's not vaccinated, and you say, but I have a titer that says it's protected. That doesn't mean you aren't going to be in trouble with the authorities. You have to go by the law. Vaccines are labeled as 1 year or 3 year. Again, it is safe to give the 3-year vaccine annually. How do I vaccinate my puppies? This is my schedule. My puppies get distemper, adenovirus 2, parainfluenza parvo, lepto 4 at 6 weeks, and are given intranasal vaccine for control of kennel cough. I give a second dose 4 weeks later, and then 4 weeks after that, I get a distemper combination without lepto, a rabies vaccine, and a Lyme's vaccine. At 18 to 20 weeks, I give the distemper combination and flu if my puppy will be going to dog parks, boarding, or dog shows. And usually in that case, it's a yes, so they get the flu. I booster all dogs at 1 year of age and vaccinate all of my dogs annually. I know that there are veterinary clinics and veterinarians who say that vaccines last longer than that. That is true under ideal circumstances, but not all dogs do. You do have an option of running titers to see if your dogs have protective levels against these diseases. Titers are far more expensive than is vaccine, and the vaccines are very safe. So I do recommend vaccinating annually. Heartworm preventative, in my opinion, is vital. It should start monthly using a product designed and licensed for dogs and should be given year-round. Today's heartworm preventatives typically control and remove roundworm and hookworm. Some of them also control whipworm. Flea and tick preventative start by 8 weeks of age. I cannot stress enough how important it is to read the label. So what else should I do? Socialization. I talked a little bit about this in the neonatal care, but be aware of puppy stages of development. The fetal period is up to birth. Neonatal is 0 to 10 days. Transition, 11 to 21. Socialization, 3 to 14 weeks. Fear period, 8 to 10 weeks. Juvenile, 3 months to puberty. And the second period occurs in some breeds at sometimes. It lasts about 3 weeks between 4 to 11 months. I will tell you the fear period is important in some breeds of dogs that tend to be more reactive. I don't believe that most Labradors recognize that there is a fear period. So an adverse effect occurring in a 9-week-old Labrador puppy probably won't bother it. In contrast, I don't know if you've ever seen the Disney movie about a Welsh Corgi puppy that has a broom fall on it. When it's uninjured, but terrified the broom. In a very sensitive puppy, an event like that is terrifying may stay with that puppy for a very long time, if not forever. If that happened to a Labrador puppy, and I can say this as a Labrador breeder, they're dense enough, they'd say, oh, well, stupid broom, and move on. So during the neonatal period, this is called early neurologic stimulation. Start this by day 3. hold the puppy in your hands, hold the puppy's head up, then hold the puppy's head down, turn the puppy on its back and let it lay there. Put the puppy's belly on a cool towel. One system that I read said put the puppy in the refrigerator for a few seconds. You could do that, but the idea is to stimulate the puppy's nervous system to react to cold and stimulate the bottom of the puppy's foot with a cotton swab. During the transition, the puppy starts to develop vision and hearing. Give them lots of different types of noise. I start banging a metal plate when I start feeding the puppy solid food so that they associate noise with getting extra calories. I use a radio and the TV, and I do try to change the radio station. I try to do acid rock. I do a station that is mostly country western. I do talk shows, all different kinds of noise and stimulation. Give them different shapes and sizes of toys and objects to touch, and many different surfaces are important. How many of you have seen a puppy that is terrified on slippery floors? It's because as a baby, they were never put on anything slippery. During socialization, this is probably the most important time in a puppy's life, from 4 to 14 weeks. This is the time when puppies develop confidence and become very, very happy. For those of you that have gun dog breeds, offer exposure to a freshly killed bird. By that I mean, ideally you would like to have a pheasant, a quail, a duck, a chucker. Just put it in the whelping box and let the puppy sniff it. Some gun dog trainers really believe that this really increases what we call birdiness in dogs. If it's going to be a family dog, make sure the puppy sees and if possible interacts with toddlers. That is important because if you watch a toddler walk, they don't stride like we do, they bob. And that is a very threatening gesture to a canine who has never seen it. Make sure they can watch that toddler walk. The toddler doesn't have to top it. Have to touch the puppy. If they do and nothing happens, that's good, but make sure they see toddlers. And also, if you have a puppy that's approaching that 14-week period, see if you can take it someplace where a toddler can offer it a treat. So the bobbing again of the toddler is very frightening, so make sure they get to see that and make sure it's associated with something good like a special treat. So during the socialization period, we talked about the fearful time at 8 to 10 weeks. Make sure that the interactions that puppies have with everything are positive. A very sensitive puppy may have a hard time overcoming something terrifying. And again, Labradors appear to skip the fear period. German Shepherd puppies do not. Some of the toy breed puppies do not. And that completes my presentation. So Nicole, I think it's time to answer some questions.
Amazing. Thank you for walking through all that. I especially enjoyed that part at the end where you mentioned how the toddler bobbing can be frightening, because we have two toddlers in my family, and our family dog is definitely very scared of them because they seem a little unpredictable. So I can definitely relate to that.
Good.
But he's almost 7, so I don't know if he's exactly learning anything new, but we do make sure they give him treats, so hopefully that helps.
Treats almost always do the trick. Make sure it's something he never gets anywhere, anytime else, and then he'll look for every toddler in the whole world.
Oh, that's good to know, like a high value special
A
treat.
high value treat, but easy to take from the child's hand.
Okay, cool. I'm gonna remember that. I'll let you know how that works.
Okay.
Okay, we have a few questions. Some are a little bit more whelping related, if we can
Okay,
answer
that's fine.
those.
Whatever.
Okay. So one of them is about asking if you could talk about whelping pauses. So when the dam is resting, nursing puppies, but not contracting. So just talking about what those whelping pauses might look like.
Okay. So it's very common for a female to have a number of puppies and then rest for an hour or two. If she's not having contractions, that's fine. But if she goes more than 2 hours with no contractions, that's certainly a stage where I start to get a little worried. And I would certainly get her up and walk her, take her outside and move her around, because a whelping interval of more than 3 hours tends to be very problematic. So I like to get them up at 2 hours and see if we can start things going again. But again, it's normal to rest, and some of them may want to rest longer, but the longer they go with between puppies, the more likely you are to have placental detachment and puppy death. If I
Amazing.
were to pick,
Oh, yeah.
I would pick the perfect interval, and I have a Labrador female that's going to have 7 puppies, I would like to see her complete her whelping in 7 hours. Now, that's not rock solid, but that's ideal. Average an hour per puppy for the whole litter.
Awesome. Thank you for answering that one. We have, I believe this might actually be left over from last week, this question, and we wanted to save it for this week. If you deworm the mother before she delivers, do you still need to deworm the puppies?
Yes, we do, for the reasons that I talked about, because some parasites are passed in milk. And so, yes, they are. And there really are no parasite-free puppies born except in that specific C-section venture that I talked about. Yes, you should.
And I know you talked about this already, but if you could reiterate for everyone, what is the optimal time to give the dewormer?
I would deworm the puppies at 2, 4, and 6 weeks of age. And then ideally, if you're keeping them monthly, and if they're going to their new homes, if the people get them on heartworm preventative right away, effectively, they are continuing to deworm them. And that's very important, because particularly, well, you can get both kids can get both roundworm and hookworm. Hookworm is an annoyance, but what we call visceral larvae migrans with roundworm, if a child is infected with roundworms, the roundworm actually, since the human is not a normal host, the roundworm can end up in the eye and cause blindness in the child.
Oh, wow.
Yeah, it's a biggie.
Um, Another question we have is asking if you have any advice for teething, which is interesting.
For teething,
Yeah.
I will give you my perspective on teething in puppies, and realize, to the best of my knowledge, other than we have data on when teeth should erupt, I personally do not think puppies suffer with teething such as infants and kids do when they're getting teeth. That being said, teething is facilitated by giving them toys that are appropriate to chew on. I think it would be fine to use dog toys and make them very, very cold, but we really don't see puppies change their eating pattern or salivate like babies do during the teething process. So I think from the dog perspective, teething is not as near the problem to the dog as we humans perceive it to be. But it sells a lot of teething toys, and they're good.
Do you have any favorite types of teething toys?
I am a huge fan of the Nylabone type teething toys. There's several other companies that make them. They're between a rubber, I'm not a chemist for plastics, so somewhere between a rubber and a hard plastic, so not quite as hard as Nylabones chew on for big dogs, but they're a puppy texture. But provide something for puppies to chew, because they instinctively will, and if you don't give them something, you may not like what they pick.
They'll find it.
Right. Puppies are very attracted, I will also say, to rubber, and that includes the rubber coating on electrical cords. So I always warn people to be cautious with electrical cords around puppies.
Yeah, I know you can get those like sleeves that you can put your
Right,
electrical cords into. I feel like those are really good. You can also fasten them higher
right.
up out of reach. But yeah, definitely a good thing to keep in mind when puppies are around because they will make a chew toy of anything.
They
Uh,
will, and they can actually electrocute themselves. Usually
yeah.
they get severe mouth burns, but they can electrocute themselves.
Yeah, so we definitely want to prevent that.
Yes,
I think we have time for one last question. I know that you are also a dog breeder yourself.
yes.
And I know the socialization period is very delicate, but very exciting for puppies. So I'm curious how you make the most of the socialization period and if you have any like favorite socialization tactics that you've picked up over the years through your own program.
Well, I would tell you that to me, the most important are noise and surfaces and allowing the puppy to see lots of things. A puppy that, say, for instance, say if I were to raise a puppy strictly in my kitchen and it saw no other rooms of the house, they become very habituated to what they see, but the new environment is different. And then it's quite threatening. So my puppies are raised in my house. In fact, we have a puppy room that's basically a family room. The flooring in that room is actually stamped concrete. It's a shiny concrete. It sounds terrible, but it looks pretty. So we can actually live in the room as well. But concrete is different from, we have hardwood. So I get the puppies on concrete, hardwood, carpeting, tile, grass, gravel, asphalt, and lawn, including leaves. And it's amazing how quickly the first new texture you or surface you put them on is very threatening, but they quickly adapt to new ones. The other thing I have puppy playground equipment, and it's actually made by a company called puppyplayground.com, I think. And it has a set of stairs, it has tunnels, and it has a bridge. And we have it in the puppy play yard. And we let the puppies play in that play yard a couple of hours a day. I mean, we start this at 5 weeks. So they teach themselves to go up and down stairs. They will go through objects. It's kind of like walking the plank. So you don't have any of this terror that you have with environmental issues. And I am by nature noisy, so they get a lot of noise just from me and my reactive. We also have cats. We have 2 cats. The puppies meet the 2 cats. One of the cats loves puppies. The other cat hates puppies, and they quickly learn how to react to a hissing cat and to the cat that wants to cuddle with them. So the more novel circumstances a puppy can see and interact with without being injured, the more confident they are.
Wow, that all sounds great. I love the idea of a puppy playground. I want to come hang out at your house. That sounds so fun. Those are all
It's really great. And for instance, even in their whelping box, we have beds that they crawl in and out of. And I'll elevate the bed a little bit or make it rock. All of those things are confidence builders. You don't make them do it, you allow them to do it. The other thing I do, I start teaching sit and come at 5 weeks of age.
oh wow.
And I do that with, again, a high value treat. And I usually use string cheese. Puppies love string cheese. And you can take little bits to get them to sit, hold the string cheese in your fingers, put it on the puppy's nose, and just raise your hand. Don't touch the puppy. And as soon as you raise their head, their little bottoms will plunk down and you say sit. Typically, day 2, they can sit.
Wow,
So
that's amazing.
very, very simple with positive teaching. Yeah, yeah.
I love that. I love hearing what different breeders do for socialization and training because I feel like everyone approaches it differently. And I love the way that you're doing it. I also did not know that puppies love string cheese. That's very fun to know.
First time they sniff it, they look at it like, what is this? Is this a setup? But as soon as they taste it, they are into string cheese.
I love that. I think that was the last question we have. So thank you again, Dr. Smith, for being here for such an amazing presentation. We absolutely love having you. We're grateful for all of your knowledge as always, and this was such an amazing presentation. So thank you again for being here.
So I just want to make one apology. I can't tell you how many times I reviewed this PowerPoint, and I can't tell you how many typos I saw today when I was showing it. I wanted to just cringe.
Well, I honestly didn't notice any of them.
Well,
So if that's
if you're careful, you will. So I did. Thank you all very much.
Thank you so much again for being here. And thank you to our audience for joining us today. If you are not yet a member of our community, you can apply to join at gooddog.com/join so you can stay up to date on all of our future webinars and events. And speaking of events, our health symposium is not over yet. We still have one more session next week to wrap up our entire month of learning. And that's going to be part 2 of our earlier discussion at the beginning of this month, which was a huge hit. I know breeders loved it. It was Breeding Healthy Dogs Part 1, which was led by Dr. Carla Barstow. So we're bringing her back next Wednesday on October 23rd at 1 p.m. Eastern for Breeding Healthy Dogs Part 2. So please bring yourselves, bring your questions. We are so excited to wrap up the symposium with this talk. So we'll drop the link in the chat to register for that if you haven't already. Again, it's Wednesday, October 23rd at 1 p.m. Eastern, and it's Facebook Live just like this. So very easy to join. And we can't wait to see you then. And another quick reminder to look out for the quiz following this session so you can be eligible to win all those exciting prizes that I mentioned earlier. And I think that's it from us. Thank you all again for being here, and we'll see you next week at our last session for the symposium. Bye, everybody. Thank you.